Hi guys, this is Dr. T. Welcome to Clinical Medicine with Dr. T. So guys, in this video I want us to just discuss or talk about when do you decide to use an LMA or when do you decide to intubate the patient. Which patients can or which patients need to be intubated and which patients can do with just an LMA. So this is how you think about it. So first of all, you have a patient that needs operation, right? And then you do your pre-op assessment, and then you decide, okay, this patient needs a GA, not a spinal, but a GA. Okay, now that we've got a patient for operation and we know that the patient needs a GA, the next important thing is this patient an emergency or is an elective? If the patient is an emergency, that tells you that, as an anesthetist, that tells you that this patient is unfasted. And because the patient is unfasted, has got an increased risk for aspiration. Right? So, because of this alone, this patient needs to be intubated. I mean, intubation, yes, it's to ventilate the patient, but also it's a good way of protecting the airway. It's a good way of protecting the airway. You have a patient that needs a GA, is an unfasted, and needs intubation. All that says to you as an anesthetist that the manner in which you're gonna do your GA is gonna be a rapid sequence induction. We do a rapid sequence for patients who have a high risk of aspiration or a risk of aspiration. So because of that, it's gonna be a rapid sequence for them. Because you're gonna intubate this patient, it means now that they need to have a muscle relaxant. And the muscle relaxant of choice in emergency situations or when you do an RSI is saxmethonia. When you do an RSI, saxmethonia. So if you look at this patient, we know why we're gonna do a GA. We know why we have to intubate, and we know why we're gonna do a rapid sequence. So we have answered this question. Maybe you ask yourself, what other patients require an intubation? So that will take us to the indications of intubation. Indications for intubation. Which patients must be intubated? a patient who's got a risk for aspiration, like our patient there, a patient who's gonna be operated in the face, facial operations, a patient is gonna be operated in the abdomen, a patient, if the procedure itself is gonna be a long operation, if a patient is gonna be operated in a prone position, and also if the airway is gonna be shared airway. So if the airway is gonna be shared with the surgeons, that patient needs to be operated. Let's say whatever procedure that needs to be done is going to be done in the airway, so that patient must be intubated. So these are the patients that needs to be intubated. Now let's go back there. Let's say now we have a patient that needs operation, needs a GA, but there is no risk of aspiration. So let's say, basically, let's talk about an elective here. It's an elective. When a patient is an elective, we assume that the patient is fasted. And you know, I've been to a theater where a patient who is an elective happens to have eaten. That patient is cancelled to come back on the next available slate, because the issue of aspiration is very, 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 very big. It's very, very detrimental. It's very dangerous. It's very important. So now let's say we've got a patient that needs an operation. We know that the patient needs a GA and is an elective patient. Because the patient is fasted, that says to us the risk of aspiration is low. Because the risk of aspiration is zero or is none or is minimal, we don't have to intubate this patient. Therefore, we can use an LMA. Because we're gonna use an LMA, it means we don't have to use a muscle relaxant to facilitate intubation, because we will not be intubating. Remember, the LMA doesn't get to the vocal cords. It's supraglottic. It stays above the glottis. So it doesn't get to the vocal cords. And when you facilitate intubation, when you give a muscle relaxant to facilitate intubation, you want to relax those vocal cords, those vocal muscles. So there is no muscle relaxant required here. No muscle relaxant, right? So I'm saying a patient is an elective, needs a GA, is fasted, therefore no risk for aspiration, therefore we can insert an LMA. We don't need a muscle relaxant to insert an LMA, so we can get away with that. So, but it doesn't change the fact that the patient still needs a GA. So GA does not always equals to intubation. That's what I'm trying to get to. GA is not always equals to intubation, right? So remember, you can have patients that are elective. They are not emergency, but they still have a risk of aspiration. What other patients have a risk of aspiration? What other patients have a risk of aspiration? Patients that have got a risk of aspiration, the pregnant, the diabetic, those with diaphragmatic hernias, what else? Can't think of any now. So these patients, they've got a high risk of aspiration, but they're not necessarily emergencies. A diabetic patient that is coming for operation, that has got a planned operation, that's an elective procedure, right? But they are still regarded as unfasted. Even these ones are still regarded as unfasted. Diabetic patients, they are regarded as unfasted because diabetes happens to damage it happens to cause neuropathy of the autonomic nervous system as well. So they get some kind of gastric emptying, delayed gastric emptying. Just like they get what they call orthostatic hypotension because of that as well, autonomic nervous system neuropathy. And then the pregnant, they also have a delayed gastric emptying because of the progesterone, the effects of progesterone. And on top of that, they also have progesterone also relaxes their esophageal sphincter, so their sphincter tends to relax and it's easy for them to regurgitate or aspirate. So yeah, I hope this does answer a lot of your questions. So always just remember that intubation, so if a patient has got a risk, if a patient has got any of these, just know that you're gonna need. If a patient has got any of these, the patient needs to be intubated, number one. And if they are unfasted, you can have a patient who needs an abdominal surgery from a step. That's an unfasted patient who needs an abdominal surgery. So there are two reasons why you should intubate that patient. Reason number one is that they are unfasted, meaning risk of aspiration. Reason number two is that they are going to be done in abdominal surgery. Those are two reasons to intubate the patient. So you will intubate, and because they are unfasted, and someone who's step is always going to be an emergency, right? Okay, as when they come, obviously if they are going back to theater for whatever, then they can be planned. But if they come immediately from the place or the scene, then they are gonna be an emergency, and because they will be unfasted, then they will be done a rapid sequence. So anyone who's got any of these, that's intubation. Because it's intubation, then a muscle relaxant is going to be used. Okay, let's talk about a patient who needs a GA, no risk for aspiration, but still needs a GA. Those kind of patients, you don't have to use saxmetonium. You can use a non-depolarizing muscle relaxant like rocuronium. Right? And just that now you need to wait for about 3 minutes for it to work. Rapid sequence means everything must be done very efficient and very fast. You give sax because there you're gonna wait for about 30 to 45 seconds before you can intubate. But here you're gonna wait for about 3 minutes before you can intubate. That's just the difference. Okay, I hope you guys will get this, and yeah, let me know if you've got any questions on the comments section. Thank you.